Welcome to LifeCourse Looking at the Big Picture, presented by Indiana Family to Family. Indiana Family to Family is the parent-to-parent organization and family-to-family health information center for the state of Indiana. These centers are statewide family-led organizations that assist families of children and youth with diverse health and mental health needs, as well as the professionals who serve them. We provide one-on-one peer support, information, education, training, and outreach. The information in this video is current as of June 2026. As with any resources or information, it is important to verify the information provided to ensure it meets the same needs as your family's respective situation. LifeCourse theory suggests that throughout all phases of development, a complex mix of biological, behavioral, psychological, environmental, and social factors impacts overall health. Simply put, personal choices, as well as things that happen beyond one's control, affect health and well-being over time. These factors are called social determinants of health and include income, education, occupation, employment, housing, childcare, family structure, and geography. The LifeCourse approach to health and wellness emphasizes preventing illnesses through developing healthy lifestyles, families, and communities instead of treating illnesses after they happen. An example of LifeCourse theory in action is the practice of regular and periodic lead screening in infants and children. Such screening is beneficial to children because it helps doctors prevent and treat lead poisoning not just in one child, but also in children who occupied shared environments, such as the same household, child care facility, school, or neighborhood. Lead screening data from one child can prompt public health officials to identify at-risk areas, investigate the source of the lead, and ultimately implement interventions such as improved water testing and purification, thereby protecting the health of the entire community. So what does it mean to you and your family? Well, you are the expert on your child, and so health and wellness begins with you. You can build healthy practices and habits in your household, including providing a nutritious diet, promoting regular exercise, and more. If you need support, your child's doctor can address social determinants of health specific to your family situation. Your child's medical home should provide health education in your family's primary language, be knowledgeable about community resources that meet basic needs and ensure safety, and assist you in accessing those resources as needed. If your child has a chronic health condition or disability, it's important to be proactive when considering the factors and impact to your child's health and well-being over time. As a parent of a child with additional healthcare needs, you may feel you have limited capacity to envision and build a healthy, meaningful life for your child, and you may require additional resources to adapt preventative and wellness strategies for your child. In 2016, Indiana's Division of Disability, Aging, and Rehabilitative Services began to examine its process for providing supports and services to individuals with disabilities. Initially, this effort focused on improving person-centered planning and case management to better support individuals and families in developing meaningful plans, including specific supports and services that move them closer to their own idea of a good life. Using the framework Charting the Life Course as a guide to the process, they use this tool that was created for families and self-advocates by families and self-advocates. It's intended to help persons of all abilities and ages create a vision for a good life, consider the resources that they need, and take any action steps that they need to help identify or find and develop supports and discover how to live the lives they want. Individuals and families may focus on their current situation and stage of life, or they may also find it helpful to look to the future to think about or explore the experiences they may wish to have. Charting the Life Course is a resource that may be accessed throughout life to map the desired course. These include focusing on all people, recognizing the person within the context of their family, the trajectory of life experiences across the lifespan, achieving life outcomes, holistic focus across life domains, supporting the 3 buckets of need, integrated services and supports across the life course, and transformational policy and systems change. When we focus on all people, it means that the vision, values, policies, and practices are person-centered, ensuring all families have choices and access to the supports they need. Individuals and families need supports that address all facets of life and adjust as the family ages and the roles and needs of the members change. Individuals and families can focus on a specific life stage with an awareness of how prior, current, and future life stages and experiences influence their life trajectory. When considering life outcomes, individuals and families plan for present and future outcomes, building capacity for self-determination, healthy relationships, economic sufficiency, and community inclusion. People lead lives made up of connected, integrated domains that affect quality of life. These domains include daily living, community living, safety and security, healthy lifestyle, social and spirituality, and citizenship and advocacy. Individual and family supports address all facets of life and adjust as roles and needs of all family members change. Strategies to support individuals and families can be broken down into 3 buckets. The first being discovery and navigation, having information and tools you need to go through life. The second, connecting and networking, building social capital and making connections and meeting peers. Finally, goods and services, the items you buy and use day to day. It's essential to consider the assets and strengths of a family and to build an individualized array of integrated supports, including those based on eligibility, community supports that are available to anyone, relationship-based supports, and technology. Individuals and families are involved in policy making to influence planning, policy, implementation, evaluation, and revision of the practices that affect them. Every program, organization, system, and policymaker must think about a person in the context of family. Additional information on this topic, as well as others, can be found on the Indiana Family to Family website at www.inf2f.org. For one-on-one support, you can complete the form found on our Connect With Us webpage. Call our main line at 844-323-4636 or email us at info@inf2f.org.